à tous nos invités. Vous êtes ici, chez vous. Au nom du peuple martiniquais, je vous souhaite la bienvenue.
President of the Territorial Collectivity of Martinique hosted the fourth meeting of the OECS Council of Ministers of Health, which was held for the first time in the presence of Didacus Jules, director.
The OECS Council of Ministers of Health is meeting in Martinique at this time, and it is one of the most dynamic structures of collaboration and collective action within the OECS.
A council that concluded with a final declaration of regional solidarity in which the OECO countries commit to 10 concrete actions, including sharing health human resources, facilitating the group purchase of health equipment and services, develop and implement common policy and legislative approaches to health, share access to specialized services, prepare and respond jointly to health emergencies, a willingness to cooperate expressed from the first day by Alfred Marie Jean, who declared,
"On my initiative, the Territorial Collectivity of Martinique approved the financing of a cyclotron and a TEP scan. These tools, dedicated to the early detection of cancer, are also intended to be yours."
The ministers began their stay on Friday with the visit of Martinique University Hospital to meet health professionals and health care facilities in Martinique, a welcome particularly appreciated by the Minister of Health of Grenada, Nicolas Steele, new president of the Ministers' Council.
I truly want to recognize the initiative of your President Marie-Jeanne and the productivity that came out of that initiative. Sitting over the last couple of days with Mr. Corral and other members of your team, which in fact no longer your team, other members of our collective team, of CARFA, of OECS, together to speak to the health challenges specifically of the region. But I cannot underscore the tremendous benefits that we will all be reaping as a result of the initiative of President Marie-Jeanne to bring us closer together politically.
Francis Carroll, Executive Councillor of Martinique in charge of health, is a strong advocate for regional cooperation in health, but not only.
Hospital cooperation is essential, and the possibility for the Caribbean to come to our country for treatment is an extremely concrete perspective. Today, there are still a number of administrative difficulties that we want to lift. That's the reason for which, with the OECO ministers, with whom we have already a very concrete cooperation. There are, for example, the Great Burns of Antigua who came to Martinique. There are St. Lucians who come for treatment at Martinique. So we decided to prepare an agreement for this reception and support. And finally, of course, this cooperation today has taken the form of health and medical cooperation, but we must go further. Our Caribbean must understand that integration is obviously health, but it's also economic development, it's culture, education, it's a set of subjects on which we must have common or at least complementary policies. We must be able, in this basin of the Caribbean, to organize a cooperation able to act on people's daily life.
A regional cooperation based on many common points between the OECO countries and Martinique, and on which Nicolas Steele returned.
The most meaningful part of this is that throughout our history we have been neighbors, we have been family, we have been friends, we have shared celebrations, but most importantly we have shared risks and we have shared disasters. Coming here this time to discuss from a point of view of health, us working together as one region, as an OECS region.
Nicolas Steele, who held a few words in French to salute Martinique and its president Alfred Marie Jean,
is to say merci beaucoup, mon nouveau amis.